Let's learn about muscular anatomy. The human body has lots and lots of muscles, at least 650. We will cover just a few. Let's begin with the muscles of the head. There are two circular muscles surrounding the eye and mouth. These are the orbicularis oculi and orbicularis oris. Here is the small muscle with the big name, the levator labii superioris olecque nasi. Covering the frontal bone is the frontalis muscle, one of the chewing muscles, or muscles of mastication. The masseter is seen here. The temporalis muscle, another chewing muscle, is in this area. The sternocleidomastoid is located on the lateral part of the neck. It originates on the mastoid process and has insertion points on the sternum and clavicle. The trapezius muscle is a superficial muscle of the back. In the chest and shoulder area, we can see the pectoralis major, which has a large sternal portion and a smaller clavicular portion. The deltoid, which has an anterior, middle, and posterior portion, and the biceps brachii. If we remove the pectoralis major, we see the pectoralis minor. We can also see the serrated muscle, the serratus anterior. The external intercostals are between the ribs. There is also a deep layer of intercostals, the internal intercostals. The trapezius muscle is a large superficial muscle in the back. It extends to the spine of the scapula and to about the 12th thoracic vertebra. The trapezius is removed on the other side, so we can see the rhomboid major and minor, splenius capitis, and levator scapula. The latissimus dorsi attaches to an area of dense connective tissue called the thoracolumbar fascia. We can also see some of the rotator cuff muscles. Some of the deep muscles of the back can be grouped together and called the erector spinae. Here is the rotator cuff in more detail. We can see the supraspinatus, infraspinatus, and teres minor. The teres major is not part of the rotator cuff. Another muscle, the subscapularis, not seen here, is on the anterior surface of the scapula. The triceps brachii is the only muscle on the back of the arm. In the anterior forearm, we can see the brachioradialis, which is lateral, and the pronator teres. Medial, we see the flexor carpi radialis, palmaris longus, and flexor digitorum superficialis. Some of the deep anterior forearm muscles include the flexor digitorum profundus, which along with the flexor digitorum superficialis attaches to the digits, and the flexor pollicis longus that attaches to the thumb. Some of the hand muscles include the abductor pollicis brevis and abductor digiti minimi, which attaches to the fifth digit or little finger. We can also see the deep muscles of the hand called the lumbricals. Moving back to the trunk, we see the abdominal muscles. There are 4 abdominal muscles. The rectus abdominis, or six-pack, is deep to the aponeurosis of the external oblique. The internal oblique is deep to the external oblique. The 4th abdominal muscle, the transverse abdominis, is deep to the internal oblique. Here is the anterior portion of the abdomen and leg. We can see a deep muscle here called the psoas major, which attaches to the lumbar spine. The iliacus attaches to the ilium. The sartorius or Taylor's muscle begins at the anterior superior iliac spine of the ilium and moves inferior and medial to attach at the medial knee. The action of this muscle is for crossing the leg. Other muscles of the leg include the tensor fasciae latae on the lateral aspect, which attaches to another aponeurosis called the iliotibial band, and the pectineus muscle on the medial aspect. We can also see the quadriceps muscles, the vastus lateralis on the lateral side, the rectus femoris in the middle, and the vastus medialis on the medial side. The fourth quadricep muscle is the vastus intermedius, which is deep to the rectus femoris. Another medial muscle of the leg is the gracilis. Here is the adductor group of muscles on the medial aspect of the leg. There is the adductor brevis, longus, and magnus. In the posterior leg, we have the gluteus maximus and gluteus medius, which are cut to reveal the gluteus minimus. The piriformis muscle is here. In the posterior leg, we have the hamstrings. The biceps femoris is lateral. On the medial side, we have the semitendinosus and semimembranosus. In the lower leg or shin area, called the crus, we see the tibialis anterior just lateral to the tibia. Laterally, there is the fibularis group of muscles. In the posterior lower leg, or sura, we can see the gastrocnemius, which is commonly called the calf muscle. Deep to the gastrocnemius is the soleus. Both gastrocnemius and soleus attach to the Achilles tendon. There are many muscles in the foot. The fibularis group on the lateral lower leg attach here, as well as some of the deeper extensor muscles of the anterior lower leg. The bottom or plantar area of the foot contains the plantar aponeurosis, which is a site of plantar fasciitis. We can also see the abductor hallucis, which inserts on the big toe, and the abductor digiti minimi, which inserts on the little toe, as well as the flexor digitorum brevis. We hope you have learned some of the muscles, and see you next time.